What's going on? My name's Mike. I'll speak to you a little bit about cardiology project we gotta do. What is cardiology? Cardiology is the study and treatment of disorders of the heart. It is a medical specialty which involves the care of all things associated with the heart and arteries. In the U.S., cardiology is a part of internal medicine. It is a discipline which includes the diagnosis, treatment, causes, as well as research into heart diseases and injuries. In the U.S., to become a cardiologist, you have to complete a 3-year residency in internal medicine and then a 3-year residency in cardiology. Cardiology has several subspecialties. Nuclear cardiology, using nuclear imaging techniques in the non-invasive study of cardiovascular disorders and diseases, including infarction imaging, SPECT, single proton emission computed tomography, plantar imaging, and myocardial perfusion imaging. The nuclear cardiologists use radioactive materials. Interventional cardiology involves the use of intraventricular catheter-based techniques with fluoroscopy to treat congenital cardiac, valvular, and coronary artery diseases. Interventional cardiologists may perform angioplasties, valvuloplasties, congenital heart defect corrections, and coronary thrombocytomas. I hope I said that right. Echocardiography, the use of ultrasound, waves to create images of the heart chambers, valves, and surrounding structures. Echocardiography can measure how well the heart is pumping blood, cardiac output, as well as determine the levels of inflammation around the heart, pericarditis. Echocardiography can be used to identify structural abnormalities or infections of the heart valves. Cardiac electrophysiology, the study of the mechanism, spread, and interpretation of the electric currents which occur inside the heart muscle tissue. The system that generates the heartbeat. During electrophysiology study, EPS, of the heart, catheters are threaded into a vein on top of the leg, guided under the fluoroscopy. The catheter makes its way to the heart. The catheter measures the electrical signals within the heart. EPS of the heart may be performed to determine whether a patient needs a pacemaker while somebody is fainting, or if other tests has found no cause, and to help decide the best treatment for patients with arrhythmia. EPS may also determine how prone a patient is tachycardia. Brief history about cardiology. Just going to read a few. 1628, William Harvey, an English doctor, was the first to describe a systematic circulation and the properties of blood that pumped throughout the body by the heart. Ibn al-Nafis has mentioned the blood circulation in a rudimentary way in a commentary in Avicenna's canon in 1241. 1733, Stephen Halley's, a clergyman whose scientific contributions in the field of botany, pneumatic chemistry, and psychology was considerable. He invented a surgical forceps for removing bladder stones, a type of ventilator. He also was the first person to measure blood pressure. 1903, William Einthoven, I think I said that right, a Dutch psychologist and doctor, developed the electrocardiograph (EKG) in 1924. He received a Nobel Prize for medicine. 1912, James Bryan Herrick, American doctor, describes signs and symptoms of heart disease that explaining that is caused by hardening of the arteries. 1951, first artificial heart valve was created, a plastic valve to repair an aortic a plastic valve to repair the aortic valve was developed by Charles Hucknagel, a U.S. surgeon. Let's see. 1952, the first open heart surgery was performed by F. John Lewis, an American surgeon. 1961, first time external cardiac massage was used to restart the heart. A procedure was performed by J.R. Jude and a team at Johns Hopkins University. 1967, a whole heart transplant for one human to another was performed, the first time by Christian Barnard, a South African surgeon. 1982, a permanent artificial heart was implanted into a patient by William de Vries, a U.S. surgeon. The medical device was designed by Robert Jarkovich, a U.S. physician.